the key recommendations are first that the same is true for ICH as it is true for ischemic stroke, and that is that these patients should be treated on a specialized unit or stroke unit. It has clearly been shown that this has an effect not only on mortality, but also on the clinical outcome of patients. So this is why we made this to be a strong recommendation. The second recommendation, or the second expert consensus statement, but I think one of the key elements in this guideline, is to acutely lower the blood pressure below 140 millimeters of mercury, and to then keep the blood pressure between 130 and 150 millimeters of mercury in bleedings that do not exceed 30 milliliters. The next thing that is recommended, to do this as fast as possible, at least within 6 hours, but best within 2 hours, and to avoid larger blood pressure fluctuations. The next recommendation is on the use of reversal agents, but that one I answered in the question before. The fourth area the guideline is dealing with is with neurosurgical interventions. It is recommended to consider neurosurgical intervention depending on the location of the bleeding, on the age of the patients, of the time window, and the technique that is available. So there are a couple of sub-PICOs to this PICO that deal with, for example, minimally invasive surgery, that deal with application of external ventricular drainage, that deal with infratentorial bleedings, where, just to give you an example, it is recommended to consider to evacuate patients when they have a cerebellar bleeding which exceeds 15 milliliters. The other recommendation important recommendation is the use of care bundles. There is a study that goes back, that was published last year, and showed that the combination of temperature lowering, normalization of glucose, blood pressure lowering, and reversal of vitamin K antagonist bleeding is of benefit, of clinical benefit for the patients. So we recommend to consider that, as we do recommend to consider even other pieces that might be, that should be part of a care bundle. For example, having a neurosurgical pathway in an algorithm, and the use of reversal agents. And the final PICO question deals with secondary prevention of ICH. And there it is things like restarting antiplatelet agents, which is something we recommend to consider. We also recommend to consider the use of oral anticoagulants in patients who have atrial fibrillation, depending on certain criteria which are in the guideline. We also recommend to continue statin therapy. And finally, we also recommend to consider the use of left atrial appendix occluder.